Hi there and welcome back to the Old School RN. It's me, Deb again. Today this is going to be a quick video about what's known as FF20 or the Further Faster programme that was launched in October 24 by the government. Okay, so what is this about? So I'm going to be talking today about NHS waiting lists, staff morale and the reality behind these numbers. So this initiative was brought about by West Streeting and the Department of Health in order to increase patients' elective operational experiences and send in like a go team, American term, go team, to speed up system performance, look at the elective waiting lists, how they can be done quicker, faster and more efficiently. But what it doesn't do is look at the workforce stress, the system performance, the effect on staff morale, and more importantly, the outcomes on patients. So I'm not going to be, bigging this up or attacking it either. I just want to show any nurses who are watching or members of the public who are interested exactly what this initiative is and what it's doing and not doing. So this is an evidence-based picture to just look at all those issues. So what is this Further Faster 20? It seems to be looking at an improvement in waiting times. So more operations, more procedures, quicker clinics, pre-assessment clinics, and just to recover the elective numbers, people waiting so long for elective surgery, and to try and reduce that down. So FF20 sits under this umbrella of wider elective recovery plan. It was launched with deals about enormous backlogs of planned hospital treatment, which occurred after COVID and were already in place and growing as a result of the austerity measures that were brought out around 2009. So the Department of Health and the government looked at 20 NHS trusts, mainly in areas that had high unemployment. Now that's another issue to go into that, but bear with me. They also had very high waiting lists, particularly for elective surgery on hips, knees, ear, nose and throat, gynecology and other things that kept people off work. And the idea was to go further and faster by bringing in these special go teams, specialist operational support, so managers, redesigning the workflow of theatre staff, creating one-stop diagnostic or pre-op clinics. Digital tools were brought in to schedule and document and cut unnecessary steps in the patient pathway. So I'm assuming AI was part of this. So it was deemed as helping patients, but it's actually an efficiency programme, not a clinical reform programme, and that's important. It wasn't a workforce recruitment programme, and it's not a funding settlement. And whether it works or not depends on whether you can actually increase or decrease waiting lists, ideally decrease them, the efficiency and the throughput without damaging quality, safety or staff well-being. Because if you have to have a waiting list because people have got other comorbidities like COPD, etc., they can't be rushed through this system. Okay. So what does this data show about waiting lists? Well, the waiting list currently stands at 7.31 million, which is around 6.2 million patients. And those patients will be a mixed bag. Some will have chronic illness, some of them won't, some will have chronic illness with an acute problem. So they'll all need to be treated differently, but this isn't in the government data. So this 6.17 million will matter because the NHS has delivered, so they say, record levels of activity, and this backlog though has remained historically high. But NHS England has described this drop between mid-2024 and late 25 as the biggest reduction in waiting lists in 15 years, i.e. very long waiting list reduction. But there's no evidence to support it. So although on paper, patients waiting more than 52 weeks dropped significantly between early 24 and early 25 and is viewed by the government as great progress. The constitutional standard, the NHS constitution standard that 92% of patients should start treatment within 18 weeks has failed. It hasn't worked. So in late 2025, NHS performance was around 62%, but that's way below target that was set for the National Health Service Constitution. So the bigger picture is the waiting lists are improving on paper or Excel spreadsheet when it's peaked, but the system remains way off the NHS's own standards, the constitutional standards. So how does Further Faster 20 fit into this? On paper, the reported results are government data suggests that within 20 of these FF20 trusts, progress has been faster than the national average. But again, there's no documented figures to back this up. So, for example, FF20 trusts reduced waiting lists by around 4.2% compared to 1.4% nationally. But what it doesn't say is how many patients died in the meantime, or how many were admitted for other things, and was that admission counted as an elective because they had the elective issue dealt with because it was causing other symptoms. So there's no clarity. And another claim is that waiting lists for working age adults, i.e. the economically active, dropped 5 times faster in these FF20 areas than elsewhere. So we see like specific operational improvements like one-stop clinics, better theatre utilisation, diagnostic capacity, and fewer unfilled appointment slots. And these individual trusts have reported such things as 4,000 extra appointment slots through the pathway redesign as a result of these operations being fulfilled and the waiting list coming down, in inverted commas. 20% reductions in waiting slots, 20% reduction in wasted appointments, digital tools to improve the outflow and documentation speed. So again, it'll be AI and verbal dictation, I presume. So from an operational viewpoint, there's legitimate evidence of efficiency gains in this FF20 cohort on paper. But I have to ask the bigger questions, and those bigger questions are, where is the evidence missing? Where has that gone? Excuse me. One of the biggest issues with Further Faster 20 is that, not that it hasn't worked, it's worked on paper, but the evidence to support that it's worked isn't there. It's just not identifiable. And I've tried to look for where this is, and I can't find anything. There's nothing been revealed. So whether that's a time thing and maybe it will come out at a later date, I don't know. But the figures are hiding. And my experience of NHS is when figures are hiding, it usually means it doesn't work. But that's just a guesstimate. But I'd say some of the biggest things, issues like blind spots, are the complication rates are not evident. Complication rates from rushing patients through hip and knee operations, spinal anaesthesia, general anaesthesia. What's happened to the patients beyond that? How many have had heart attacks and died? How many have ended up having operations redone? Surgical safety. Has speeding this process up and having a go team enhanced surgical safety? Has it led to a shorter length of stay? Has it reduced hospital readmissions? And I've got a good guess looking at A&E that it hasn't, that its actual readmissions are increasing. That's why we haven't got the numbers. And they're clinical quality indicators, but not part of the FF20 dashboard. So they've kept those figures separate. So we can't say if this FF20 has actually improved safety. And we can't say it's harmed safety because the data just isn't there. It'll be there if you dig in other numbers, in other measurables, but we can't find it. Workforce. There are no outcomes on what's happening with the workforce to report to anybody about FF20. There's no published data on whether it's improved morale, worsened burnout, affected the retention of staff, has it impacted on recruitment, or changed career satisfaction. Well, in terms of career satisfaction, it is what it is. Recruitment is on hold and being frozen, and occasional agency staff are being brought in. but there's no figures to back that up either, except for the agency nurses. But given that the NHS workforce is under severe pressure, the absence of morale data is quite notable. So another way of measuring that is staff sickness. So NHS staff sickness is measured nationally. So in 2025, absence rates hovered between 5.1 and 5.7%. It's always hovered around 6% at the highest, depending on the month of the year, winter being worse. Now, those levels are high and stable, but they're driven by stress and mental health related absences, and that has come from NHS Digital. But importantly, there seems to be no link and no data between FF20, this Go team coming in, and improved sickness data. There's no link between worsened sickness data and FF20 either. It's just not measured at this local level. Now, why? Is this just a paper cover up, wallpaper the wall's falling down behind it? Cost transparency. Another missing piece of the puzzle is the cost benefit analysis. So we don't have cost per patient saved, cost per theatre session gained, cost per waiting list reduction, or an audited value for money statement. So the NHS in England has spent billions on recovery, elective recovery, diagnostic hubs, digital tools and AI. But the Further Faster 20 specific costing is not transparent in the public domain, and that raises questions for me. So you can't say it's good or bad, you can only make an inference on the lack of data. But why is that data unavailable? Because in my experience, as I've said before, missing data normally means bad outcomes, and they don't want this to come out. The government want this hidden. So let's do a system level recovery check. Let's just have a look at this data. Elective care is tied to everything else. Whatever happens in elective will impact on other specialties, particularly A&E, emergency care. So if emergency care and urgent care are struggling, elective care gets cancelled, the staff get moved elsewhere, morale drops. Nurses work in various areas, doctors too, and specialise for good reason. It's what they're interested in, it's what they enjoy, it's a known, it's good patient care. But to be moved off to areas that you're not familiar with is not good for patient outcomes, and it's not good for staff morale. Now here's the reality. Emergency departments, or A&Es, across the UK continue to record thousands of 12-hour waits and millions of 4-hour breaches. I mean, they should get rid of that anyway, but hey-ho. Community services are reporting 2-year waits for non-hospital care in some regions, and that matters because when we talk about productivity or efficiency in theatres, we're often talking about the only area that's a controllable part of that system that is otherwise under extreme strain. So even if this Further Faster 20 improves throughput in an operating theatre, it won't solve all the other overarching principles, i.e., and other areas, bed shortages, social care discharge delays, ambulance handovers, chronic workforce shortages, or emergency escalation policies, which means improvements on paper can be real or seem real, but they don't necessarily fix the system. And A&E is often the indicator for how well a hospital's services are functioning. Who's coming back in, who's not, what complications are they coming in with if they've had elective surgery, etc., etc. So the national workforce picture, let's just have a look at that, because that's often an indication of how healthy a hospital is. The national NHS data shows that sickness and absence is round about 6%. They say 5 to 6. It's always been around 6, particularly in the last 20 years. And burnout indicators are high in annual staff surveys. They're so-called anonymous, but they never are. And persistent concerns around workload and retention. Retention is key. The staff survey does show gains in some engagement metrics year on year, but the underlying themes remain. And these staff surveys are not just for nurses, they're for doctors too, all the way up to consultant level. Demand is outstripping workforce capacity. Too many patients, corridor care. And again, this Further Faster 20 programme has no published data to link the interventions to the workforce outcomes. So we can't see if it's working or not. It's just an unknown. So why this was brought in, all I can think of, it's a bit of PR. It's a PR cover-up. Because if it's not linked to any reasonable data outcomes, why have it? So the balanced view, let's just be kind and just have a look at this as a standalone. I'm trying to be a bit more measured in how these things come across rather than my usual cynical self. But I'd say the first thing is that this FF20 Further Faster 20 initiative appears to have, on paper, genuinely reduced waiting lists in these 20 selected trusts. However, the operational efficiency methods like theatre flows, one-stop clinics and digital dictation appear to have delivered gains on paper. But in reality, in practice, that doesn't seem to be the case, and A&E is the measure. At national level, elective waiting lists are down from how they peaked, but they're still far too high. The waiting lists are too high above those constitutional standards, the NHS constitution that the government overhauled and revised. So there's no published evidence to connect FF20 with staff morale, reduce sickness absence, improve patient outcomes, reduce complications in patients, or financial value for money. The wider NHS system, particularly A&E and community care, is under pressure that this FF20 does not directly address. And that's interesting. If it doesn't directly address it, they're hiding something. There's something being hidden. And I'm going to keep my eye on this. So wait for more. The fairest and most intellectually honest conclusion from me is this FF20 is not a cure-all or even a glimpse of how to send Go teams in to bring down waiting lists. It's also not totally meaningless in terms of PR, but PR nonetheless, I'd say, as a nurse, my opinion, my experience. It's a targeted elective throughput programme that appears to have delivered real efficiency benefits in a very specific part of the NHS system, machine, culture. However, without data on the quality, the safety, the workforce well-being and the financial impacts, the programme should be seen as just an operational tool, not a holistic healthcare solution, because you can't fix just one thing in healthcare. There are too many other issues tied to it. So if a policymaker in the government wants FF20 to evolve into something more meaningful, to move on from, to make further evaluations and improvements, there's got to be outcome level clinical metrics to look at patient complication rates, readmissions to A&E, safety and patient experience indicators, workforce morale and sickness monitoring. The cost benefits, they have to be transparent and reported by an objective company, ideally accountants, because that's what they're good at, not linked to the NHS though. But until then, the honest verdict to me is it's helpful in the 20 areas that they looked at, but incomplete and not a solution to reducing workload, waiting list workload, because they haven't got the staff to do it. They're trying to stretch a system that's already stretched. So if you found this useful, because I can talk about this all day, I'll try and keep it short, and you find it useful, consider subscribing and hit the like button and the bell. And if you work in healthcare and this resonates with you, share it with your colleague, because silence protects systems, not patients.